Question 1. While transporting a cart of sterilized instruments, a technician navigates through the main sterile processing department, SPD, hallway. Which of the following situations represents a physical safety hazard stemming directly from the work environment? A. A puddle of water left near the cart washer causing a slip hazard. B. A punctured red biohazard bag leaking blood onto a tray. C. Vapors escaping from an improperly sealed glutaraldehyde soaking basin. D. Reaching into a sharps container to retrieve a dropped scalpel. Correct answer A. Knowledge point explanation. Core rationale. Physical safety hazards are often directly related to the physical environment of the facility, such as wet floors, cluttered hallways, or uneven surfaces that cause slips, trips, and falls. Trap analysis. Option B is incorrect because leaking blood presents a severe biological hazard, bloodborne pathogens, not a standard physical environmental hazard. Option C is wrong as escaping chemical vapors constitute a chemical hazard requiring specialized ventilation. Option D is incorrect because handling sharps involves biological and puncture risks, and reaching into a sharps container is a severe protocol violation, not a general environmental hazard. Concept extension. To mitigate environmental physical hazards, spills must be cleaned immediately, and wet floor signs must be explicitly deployed to warn approaching staff. Question 2. A department supervisor is tasked with auditing the facility's risk management program to minimize legal liability and prevent future staff injuries. Which of the following administrative duties is strictly excluded from the core components of risk management? A. Implementing continuous injury prevention training for new hires. B. Processing and tracking claims related to workplace accidents. C. Managing routine staff scheduling, payroll, and daily personnel disputes. D. Conducting proactive risk assessments in the decontamination area. Correct answer C. Knowledge point explanation. Core rationale. Risk management involves analyzing potential hazards, preventing injuries, and managing legal and financial claims. Routine staff management, such as scheduling, payroll, and interpersonal conflicts, is an operational or human resources function, not a component of the risk management program designed to reduce physical losses and liability. Trap analysis. Option A is wrong because injury prevention is a foundational pillar of proactive risk management. Option B is incorrect as claims management, handling the financial and legal fallout of an injury, is a critical reactive component. Option D is wrong because conducting risk assessments is the primary method used to identify and mitigate hazards before they cause harm. Concept extension. Employees contribute to the risk management framework by immediately reporting all incidents to their supervisor, enabling the completion of the Occupational Safety and Health Administration, OSHA, 300 log. Question 3. During an annual safety review, the lead clinical educator categorizes the dangers present in the sterile processing department, SPD. While physical, biological, and chemical hazards are the three general categories, which of the following is technically classified separately as a stressor? A. Exposure to vaporized hydrogen peroxide during sterilization cycle aborts. B. Repetitive motion injuries and back strain from lifting 25-pound, 11.3 kilogram, trays. C. Accidental puncture from an improperly disposed suturing needle. D. Burns sustained from contacting the uninsulated pipes of a steam boiler. Correct answer B. Knowledge point explanation. Core rationale. In foundational occupational safety classifications, repetitive motions, heavy lifting, and awkward postures are specifically categorized as ergonomic stressors rather than one of the three general occupational hazards: physical, chemical, biological. Trap analysis. Option A is wrong because vaporized hydrogen peroxide is strictly a chemical hazard. Option C is incorrect as a contaminated needle presents a biological hazard, bloodborne pathogens, alongside a physical cut. Option D is wrong because thermal burns from hot steam pipes are classified as a physical hazard. Concept extension. Ergonomics is the science of fitting the work to the worker to prevent musculoskeletal disorders, MSDs, emphasizing pushing carts rather than pulling them. Question 4. Under the Federal Hazard Communication Standard, which specific group of individuals is legally required to have unrestricted access to information about chemical hazards, such as safety data sheets, SDSs? A. Only the departmental supervisors and designated facility safety officers. B. Exclusively the technicians assigned to the negative pressure decontamination area. C. Only the personnel responsible for operating low-temperature sterilizers. D. All staff members employed within the healthcare facility. Correct answer D. Knowledge point explanation. Core rationale. The right to know standard mandates that all employees, all staff, working in a facility must have continuous, unrestricted access to safety data sheets, SDSs, for every chemical they might be exposed to, regardless of their specific assigned zone or shift time. Trap analysis. Option A is incorrect because locking SDSs in a supervisor's office violates the rule that every worker must have immediate access. Option B is wrong because chemical hazards exist outside decontamination, e.g., in sterilization areas and the prep and pack side. Option C is incorrect as low-temperature sterilization is just one area. Workers handling high-level disinfectants or enzymatic detergents also need full access. Concept extension. SDSs must detail specific first aid and spill cleanup procedures, and must be available 24 hours a day, 365 days a year. Question 5. Which federal entity strictly mandates that healthcare facilities provide adequate ventilation systems, appropriate personal protective equipment, PPE, and safe work operating procedures to protect employees? A. U.S. Food and Drug Administration, FDA. B. Occupational Safety and Health Administration, OSHA. C. U.S. Environmental Protection Agency, EPA. D. Centers for Disease Control and Prevention, CDC. Correct answer B. Knowledge point explanation. Core rationale. The Occupational Safety and Health Administration, OSHA, is the primary federal agency dedicated solely to workplace safety. It legally requires employers to provide engineering controls, like proper ventilation, PPE, and standardized safety training to protect the worker from occupational hazards. Trap analysis. Option A is incorrect because the FDA, which is an administration, not an agency, regulates the manufacture of medical devices and sterilants, focusing strictly on patient safety, not employee workplace safety. Option C is wrong because the EPA regulates environmental emissions and the registration of environmental disinfectants. Option D is incorrect as the CDC provides public health guidelines and infection control recommendations, not legally enforceable workplace safety laws like OSHA. Concept extension. If a technician refuses to wear the PPE provided by the employer, liability for an injury may shift to the technician due to the legal principle of shared responsibility. Question 6. A sterile processing, SP, technician is assigned to operate the ethylene oxide, ATO, sterilizers for their entire 8-hour shift. To ensure regulatory compliance and prevent chronic tissue damage, the facility actively monitors the airborne concentration of this toxic gas. Which of the following specifically defines the maximum allowable chemical exposure calculated evenly over this standard 8-hour workday? A. Short-term exposure limit, STL. B. Time-weighted average, TWA. C. Permissible exposure limit, PEL. D. Hazard Communication Standard, HCS. Correct answer B. Knowledge point explanation. Core rationale. The time-weighted average, TWA, is a critical occupational safety measurement that calculates the average airborne concentration of a hazardous chemical to which a worker is exposed over a standard 8-hour period. It ensures the total daily intake remains within safe bounds. Trap analysis. Option A is wrong because the short-term exposure limit, STEL, measures the maximum concentration a worker can be exposed to continuously for only a short 15-minute period, not 8 hours. Option C is incorrect as the permissible exposure limit, PEL, is the absolute legal maximum ceiling of exposure, not an averaged calculation. Option D is the overarching Occupational Safety and Health Administration, OSHA, regulation regarding chemical awareness, not a specific exposure calculation metric. Concept extension. Facilities using ETO must perform specific routine air monitoring to ensure that the chemical levels consistently remain below both the mandated TWA and PEL. Question 7. An employee repeatedly experiences musculoskeletal strain from lifting 25-pound, 11.3 kilogram, instrument trays and standing on hard floors in the preparation area. To reduce this physical stress, the department installs anti-fatigue mats and enforces the use of transport carts. The scientific process of changing these working conditions to fit the worker is known as A. Post-exposure prophylaxis. B. The risk management program. C. Ergonomics. Correct answer C. Knowledge point explanation. Core rationale. Ergonomics is defined as the science of fitting the work environment, tools, and processes to the worker. Its primary goal is to change working conditions to reduce physical stress and prevent musculoskeletal disorders, MSDs, caused by repetitive motion or heavy lifting. Trap analysis. Option A is wrong because post-exposure prophylaxis refers to medical treatments administered after a biological exposure, like a needle stick, to prevent infections such as HIV. Option B is incorrect because while risk management encompasses all facility safety, ergonomics is the specific science targeting physical body strain. Concept extension. Ergonomic principles in the Sterile Processing Department, SPD, mandate that heavy items be stored in the power zone, between the waist and chest, to avoid excessive bending. Question 8. Due to the splashing of water from manual cleaning sinks and cart washers, the decontamination area presents a continuous physical hazard. To proactively reduce the risk of slips and falls in this wet environment, which of the following is a mandatory administrative control? A. Park all heavy mobile equipment in the main hallway outside the department. B. Check each transport cart's weight strictly before moving it off an elevator. C. Enforce the use of closed-back, non-skid footwear for all personnel in the area. D. Utilize folded paper wrappers to quickly absorb localized chemical spills. Correct answer C. Knowledge point explanation. Core rationale. To directly reduce the risk of slips and falls, particularly in constantly wet areas like decontamination, departments must rigidly enforce the use of specialized non-skid footwear with closed backs and toes for all operating personnel. Trap analysis. Option A creates a new hazard by cluttering the main egress hallway with equipment, violating fire safety codes. Option B is an ergonomic safety measure designed to prevent muscle strain, not a preventative measure against slippery floors. Option D is highly unsafe. Paper wrappers do not neutralize chemical spills, and leaving them on a wet floor actually exacerbates the slipping hazard. Concept extension. Spills must be addressed using dedicated absorbent materials or mop systems, and wet floor caution signs must be actively deployed to alert coworkers. Question 9. During the manual cleaning process, a technician encounters a deep soaking basin filled with opaque, sudsy enzymatic detergent and cannot see the contaminated instruments resting at the bottom. To prevent a severe puncture injury from hidden sharp objects, what is the absolute safest action the technician should take? A. Drain the fluid from the sink or basin completely before attempting to retrieve any items. B. Wear heavy-duty utility gloves to blindly grasp the metal objects at the bottom. C. Ask a coworker to help visually inspect the surface of the sudsy water. D. Vigorously swish bare hands through the detergent to locate the items quickly. Correct answer A. Knowledge point explanation. Core rationale. Standard biological safety precautions strictly dictate that when a technician cannot see what is inside a sink or basin, they must drain the sink or basin completely to visually expose the items. Reaching blindly into cloudy water poses a massive risk of needle sticks or cuts from hidden scalpels. Trap analysis. Option B is incorrect because even heavy-duty decontamination gloves can be easily punctured by surgical scalpels if a technician reaches blindly. Option C is ineffective. A coworker looking at the surface of opaque foam does nothing to locate the hidden sharps below. Option D is a catastrophic safety violation, inviting immediate bloodborne pathogen exposure and physical trauma. Concept extension. If draining is not immediately possible, technicians must use sponge sticks or forceps to carefully probe and separate items within the tray instead of using their gloved hands. Question 10. Which of the following procedures is strictly required to ensure sharps safety and prevent the transmission of bloodborne pathogens like hepatitis B and HIV within the sterile processing department, SPD? A. Disposing of all single-use scalpel blades and glass ampoules in a puncture-resistant, red biohazard container. B. Pointing the sharp ends of heavy surgical retractors towards one's body during transport to shield bystanders. C. Reaching into a filled sharps disposal box to carefully compact the contents to save facility space. D. Manually recapping used suturing needles with both hands before discarding them into the regular trash. Correct answer A. Knowledge point explanation. Core rationale. Sharps safety protocols legally require disposing of all single-use sharps, such as needles, blades, and glass, into an appropriate, puncture-resistant, leak-proof container that is strictly designated and color-coded red for biohazards. Trap analysis. Option B is incorrect. Sharp ends must always be pointed away from the body, and others, during transport to prevent accidental impalement. Option C is a severe violation. Technicians must never reach into a sharps container, and they should be sealed and replaced when they are 2/3 to 3/4 full, not compacted. Option D is wrong because manual recapping is a primary cause of injuries, and sharps must never be placed in the regular trash. Concept extension. Employers must develop a written exposure control plan and offer the hepatitis B vaccination to all employees facing occupational exposure to bloodborne pathogens.